And a good day to you. This is Owen McCafferty. Just want to provide a short idea of thoughts and commentary about what's occurring in the area of tax and practice management for a few of our beloved medical professions in veterinary medicine, dentistry, and dermatology. Right now, overtime issues have become a factor because people are losing jobs. When people lose jobs, other people are needed to supplement. In a classic family unit, as we found out in 2009, when people lost jobs, there was a need for others to have extended hours and to have overtime. We see this occurring a lot in the medical professions because the support staff that relates to a practice is filled with folks who are very educated, that are paid a good hourly rate, so the time and a half becomes a major issue. Coupled with all of this, you really don't have to worry too much about your doctors because the doctors are paid at a rate that exempts them from being subject to any sort of overtime. But I think we're going to find that the overtime issues that occurred in late 2008 and then really popping their ugly head in 2009 and going all the way up to 2015 are going to be back again. Every week I hear of more individuals that are having jobs laid off. In the automotive industry especially, it's becoming acute. The number of days that vehicles are sitting on dealer lots is going in excess of 365 days for some of the brands. So I think you're going to find that there's going to be a drop in the demand for people. Ironically, this drop is going to be coupled with a diminishment of the subsidy the government has been offering individuals who don't work. I think you're going to see a limitation in the amount of unemployment compensation that's going to be available. And I think you could even see some sort of adjustments that are occurring in workers' compensation. All of this means that you have to be diligent in 2024, the last quarter, and into 2026 for what I believe to be a recessionary environment brought about by individuals where one person in the family unit has lost their job and the other person has to be able to supplement it with additional overtime hours. For this reason, there's some planning ideas that you should consider. Number one, if you're going through new construction, larger spaces are greater opportunities for people to hide. People that hide need to be entertained. When they're entertained, they have to have other individuals who can share in the joy of not specifically having outside work. So we found in 1999 to about 2001 that there was this type of situation where there was a lot of expansion of medical facilities, but individuals really were looking for ways to be entertained because they themselves didn't want to put in the classic work week. I think we're going to see something that's very similar to that occurring in 2025. So I'm asking everybody who's listening to this short webcast to at least be diligent of that issue. Scheduling becomes crucial. Not only scheduling for diminished workload of patient hours or client hours as it would be in veterinary medicine, but also the hours of availability that individuals would like to be coming into a practice. Expect in dentistry that there will be a stretching out of the timeline, that patients will be seeing doctors. Expect dental hygienic income to be diminished a bit. We're starting to already see that. Within veterinary medicine, expect an elongation of the time between the moments that an individual would be available to take their pet in for a classic exam. In the area of veterinary boarded specialties, expect there to be an elongation of the time that individuals would be as willing to take advantage of the resources available, especially in surgery. For these reasons, I think we're going to find that there's going to be a diminishment in the activity, and therefore you have to be rather diligent in the needs that occur in each and every practice for staffing. In a normal recessionary environment, people are fearful to dismiss individuals because they themselves know that it's difficult to find people. But when that becomes elongated for a period of time, you're going to see that diminishment in the need for people will result in layoffs occurring. A lot of practices will probably come to the conclusion that it's less expensive to have an undersupply of people, and more expensive to have an oversupply of people. And when the need does happen, do exactly as we're doing now, and that is overpay for a job talent and a skill set. So with all these things in mind, just a short little note that yes, times are already at us. The car industry is a classic example of where things are going. Ironically, larger accounting firms are starting to diminish people, starting out with the consultory side. We're seeing a layoff occurring in some of the big four firms that really astounded me, a bit surprised. So we'll see where all of this goes. We're going to keep an eye on it. We're going to surely make commentary so that you're prepared. But right now, if you're having trouble hiring people, don't feel that you have to make up for it by merely hiring individuals to fill alleged need. These same individuals will probably have to be counseled out at some point in the future. It might be better to, especially during the summer months, consider working with the staff that you have, treating them extraordinarily well, and not going out and being wild about trying to hire other individuals. I think you will see that there will be an amendment in the mentality and a reactivation towards hours that will be needed in excess of the classic 40-hour work week, because family units need the money. So with that in mind, I'd just like to say thank you very much. This is Owen McCafferty, and we will talk in a bit.